Stem cell treatment for Parkinson's disease. To begin, what is Parkinson's disease? Parkinson's disease is a neurological disorder where the neurons in your brain are either damaged or impaired, which results in decreased amounts of dopamine being produced. Dopamine is important to the body because it is the main chemical responsible for motor function, as it's a neurotransmitter, meaning it relays electrical impulses from neurons. What are some symptoms of Parkinson's disease? Symptoms may include tremors, stiffness in arms, legs, and torso, poor balance and coordination, difficulty in speech, slowness in movements, and loss of automatic functions like blinking, smiling, and other everyday tasks. Who does it affect? Although both male and female can have Parkinson's, males are 50% more likely to have it. Normally, it'll start to develop once you're over 60 years old, but if in the case of early onset, you may start seeing symptoms before you turn 50. Previous treatments. The most common treatment for Parkinson's is the medication levodopa, which can be either taken orally, injected, or inhaled. This medication would work by being introduced to the body and would be transported into the brain. As soon as it makes it into the brain, it transforms into dopamine, which is what's needed for motor function and which is what is lacking if you have Parkinson's. The cons to this treatment. The drug per se doesn't help your neurons, but only helps treat the symptoms. As you continue using the drug, it loses effectiveness and the symptoms start to return because the disease has progressed while taking the drug because it hasn't helped with the neurons. Now, let's get into what stem cells are. Stem cells are cells in the body that have yet to specialize in something, meaning they can be transformed into any cell that the body needs at the moment. What type of stem cells are used? For the treatment of Parkinson's disease, they use bone marrow-derived mesenchymal cells, which are adult stem cells that can still transform into other types of cells needed in the body. How it works. The patients have the stem cells transplanted in the sublateral ventricular zone of the brain, which is located on the outside wall of each lateral ventricles of the brain. The stem cells help to repair the damaged neurons and produce new ones as well. Since stem cells reproduce asexually, they can create more neurons over time, which with more treatments the effects of the treatment will increase drastically. Here's a study that they did back in early 2010. The study was conducted by Neelam K. Venkataramana and some of his colleagues as well. The study included 7 Parkinson's disorder patients ranging from ages 22 to 62 years old. Each patient received a single dose/transplant of the stem cells and were monitored over the course of 10 to 36 months. In the end, only 3 of the 7 participants noticed significant improvements, which doesn't seem like much, but considering they only got 1 dose and the trial wasn't able to continue, it's still a start. Although the trial didn't prove effectiveness but the results did encourage future trials. Not too many results have been published since then, so the results of the trials aren't well known. And that is the end of my presentation.